So I'd now like to welcome Dr. Rob Rutledge to present on fear of recurrence and 5 ways to lessen anxiety. Dr. Rutledge is the clinical lead for the Prostate Cancer Patient Empowerment Program and the clinical lead for the Cancer Patient Empowerment Program. He's also a radiation oncologist with Nova Scotia Health Authority and Queen Elizabeth II Health Sciences Centre in Halifax, Nova Scotia. Dr. Rutledge's education involves an undergraduate math and computer science degree, a certificate in community health, clinical epidemiology, and a Doctor of Medicine degree, all from the University of Toronto. He's completed a comprehensive internship in medicine at Queen's University in Kingston and the Radiation Oncology residency program at University of Ottawa. Dr. Rutledge brings with him over 25 years of experience empowering cancer patients with education about cancer care and survivorship. So thank you so much for joining us, Dr. Rutledge.
Thank you, Abby. Very, very impressive what Melanoma Canada is doing. And I just want to thank you folks. So first of all, hats off to each and every one of you who's joining the webinar tonight or watching the video afterwards. I really believe you can profoundly influence your health and your happiness as well. And I've been super interested in remarkable cancer survivors, people who do way better than expected, people who've undergone spontaneous remission. It seems to me that, the stories are people who've had a melanoma diagnosis who can actually do that as well. So it's possible, I think, is the takeaway. And I also believe that this topic, fear of melanoma recurrence, is very important. It's first of all, it's the number one unmet need of people affected by cancer. But I also think that you can influence your kind of physiology, and you can also feel happier if you work with you manage those fears and empower yourself in very practical ways. So I was very happy to see in the chat people talking about, how do I gain peace of mind? How do I get reassurance and knowledge and so on? And so I'm really hoping between myself and Margot, who's the wonder social worker from Princess Margaret Hospital, who's going to talk on the second half of this talk, is that you'll walk away with some practical ways to really empower yourself and to give yourself the best chance of recovery and to really boost your immune function, which I really think, in the melanoma world is actually going to make more and more of a difference, especially as we develop new immune-based therapies. That kind of combination of what you can do to empower yourself and then kind of some of these newer molecules can really make a huge difference. So I'm excited to do this talk, and I think this really can help you in the long term. So take home points. First of all, it's normal. We humans are going to be anxious when we're faced with some uncertainty. It's like a life force energy that you can harness in some ways to empower yourself. So that's the kind of the takeaway. So we're not going to, have no anxiety, no fear. It's like, it's going to happen, but it is manageable. It's going to be temporary, and that you can work with this and actually, make it help for you, make it work for you. So one of the ways that I think about this is to focus on those things that you can control, right? So boosting your immune function through the various activities that I'm going to talk about, for instance, or putting your life energy into things that are most important to you, like your relationships, for instance. A key point around this is to be compassionate towards yourself, because as those fears come up, and they will come up, to be struggling against, you shouldn't be feeling this way, actually just adds an extra level of suffering. And so it's better to be compassionate and understanding with yourself. And that allows actually the psychological mechanisms to work and for you to kind of work through those ideas. So, and lastly, you can actually do this. You can actually change your brain, how your brain perceives your ways of being, the physiology within your body, the soup in which cancer cells can grow. You can all change that stuff and ultimately be healthier and happier. So, okay, so what I'm trying to cover before we hand it over to Margot is really up to this idea of working with our thoughts. So, and I want to use a kind of a practical, but kind of science-based approach to say, this is how you do it. This is how you empower yourself. You get yourself stronger and get better immune function, for instance. And the first concept is that we use the best care from the medical system and we combine that or marry it to what you can do to empower yourself. So that's the total piece, what I call complete cancer care, complete melanoma care, or integrative oncology. And so there's the information piece is what you're getting, understanding what you can and can't do, what you can and can't control, letting go of the rest. Getting the best care of the medical system is a whole other 30-minute talk in terms of how to advocate for yourself. But there is an overlap here in terms of understanding melanoma such that you have less anxiety about it. And then there's the empowerment piece that I'm going to talk on briefly, like the physical stuff you can do, but also healing at the level of the mind. Margot's going to go more into that. And ultimately, there's a spiritual perspective of what do I want to put my life force energy into? What's most important to me is part of that perspective. Okay. One of the things I think is very important is that you be conscious or deliberate about how you want to be in this world. So it's what in the first exercise, I call it setting the intention, meaning, thinking about a difficult situation or any situation in some sense. Ask yourself, well, how do I want to be? Like going into a medical appointment, I want to be confident. I want to be clear thinking. I want to be able to advocate for myself, right? So you're consciously setting your intention for that. Or in the day-to-day, I want to be more at peace. I want to be loving. I want to be caring. I want to be compassionate. It's whatever you think is best for you in your life. And so you can do that as a ritual. And I do that in the mornings. I do like a meditation for about 10 minutes. And then I turn my hands up and I'm kind of in the receptive mode. It comes in secular language, guide me, help me be the best person I can be. And then I think to myself, I want to be kind. I want to be helpful. I want to be compassionate. So I'm setting the intention for the day, right? In the same way, when you focus there, then you're less likely to be drawn into the fears and the issues and the chaos, et cetera, et cetera. So you're more like, this is how I want to lead my life. It's like being very deliberate and clear about that. And the more you practice that, the better your brain, your neurocircuitry gets at manifesting that. And then going into difficult situations, right? Going into the cancer center, you're about to get your scan results, then you can focus, you can have a moment, breath, slow breath out. I can do this. Let's take this one step at a time. That's kind of the self-talk, right? And so you decide in that moment what's most important, and you come back to those values again and again. And then also in the midst of it, and this is the most difficult one, when you're stressed, when you're flustered, when those fears are coming up, can you come back home? Can you practice coming back home to center, back home to self, back home to yourself? So it's a bit of a practice with time, but you can do it. You set your intention, you practice that on the day-to-day, and you get better and better and better at saying, okay, well, this is how I want to be in the world. This is what I hope for myself. And that by itself is probably a home run idea, right? Because you practice that, and then the fears will diminish naturally because you're putting more energy into what's most important. Okay, anxiety is normal, right? We human beings, when we're faced with uncertainty, and not enough information, we're going to feel anxious. So when we're diagnosed, it's often unexpected. It's all these decision-making issues. It's like, suddenly the sense of self is shattered. Like, what is my role in this world if I'm, having to deal with a melanoma diagnosis? And then there's a sense of loss and grief. It's normal. This is expected. That you're going to, your life as it was is no longer. And so to be able to grieve and let that go is a healing step. Right. So we acknowledge, we experience those emotions, we allow them to go through us. We don't have to judge ourselves for those emotions that happen. And healing takes time. It has a certain kind of time pathway. And then I also often see at the end of treatment, I call it the end of treatment meltdown. Essentially, it's like the medical system is taking care of you, and then suddenly you're released out into the world, right? And you're back to, getting life back to normal, and, people expecting things to be normal, et cetera, et cetera. So it's a difficult time of transition, the new normal. Fear plus anxiety creates anxiety. It's okay. That's expected. We can work with it. We can learn from it. So the background. So what is it? It's a fear, worry, concern related to the possibility of the cancer coming back or the cancer worsening, for instance. it ranges, obviously, just know from mild concern to debilitating anxiety, right? And we're going to have kind of flares up and downs. That's the other guarantee, is that things are going to change and they're going to come and go. It can happen at any time. And then it's multidimensional. You may experience this as kind of intrusive thoughts, or the emotional feeling, like that feeling of anxiety, or it can also debilitate you, take you away from doing things that you want to do, or force you into doing, other things, being too hypervigilant, for instance. And so it's on a spectrum. And I'm also quoting Sophie Labelle. She's a psychologist, psychologist from Ottawa. So she's really a Canadian-wide, worldwide expert in fear of recurrence. So obviously it's this kind of range there. And I'll just read the quote. It's like a whale that moves into your living room. So you were talking about fear of recurrence. Over time, the whale gets smaller, but never quite goes away completely. The 10 you can't quite get rid of. Maybe gets down to the size of a magazine rack. Once in a while, you bump into it, and sometimes it swells up in your face again, like when you go for scans, right? So I like this quote because it recognizes that it's going to be there. It's a normal thing, and we don't have to force it away. We don't have to get rid of it completely. In fact, our anxiety can drive the positive behaviors as well. And so there's this whole spectrum of different things. I'm not going to read them all, but you just get an example of believing that your cancer will return, all those thoughts around it. If it's lasting longer, if it's interfering with activity, so it's impacting your individual daily life, you're running into those features. And then really, I think what's most important is to understand how it influences your life. Are you avoiding things? Are you avoiding appointments, for instance? That would be avoidance. Are you feeling excessive distress? Can't make decisions, can't do your job, can't do the things that you love to do. They're too intrusive. So it's this spectrum, and understanding that we're going to go through good times and bad times there. How common is it? It really varies. I saw anything 64%, 90% people have a cancer diagnosis, moderately 50%. If you're in a vulnerable population, we'll talk about that in a moment, it's higher. 7%, like 1 in 16 people, are really debilitated after they get a cancer diagnosis, right? And so part of this talk is to say, if you're in that feeling like totally overwhelmed, how do you get yourself out of this? Number one, unmet need. Okay, so if you're just prone, you have an anxious personality like myself, you perceive greater risk, then that it puts you at risk. If you feel like you can't cope, have lower coping strategies, if you need reassurance, maybe women are slightly higher risk. Maybe the men just don't report as much. Younger age, certainly if you're having symptoms or a lower quality of life, you kind of start to make an association. It gives increased fear. Feeling isolated. And I don't know, 40% of us are living alone right now. So I'm going to ask you to start to think about, what are your triggers? So I think it's really important to look directly at your fears. I think that's one of the main points I want you to take away, is to be able to look at the fear directly and live through the fear, not to avoid, not to distract, to simply be with it when it happens. It's so incredibly important. And part of that is to be able to see the patterns. The patterns are so important. So it could just be the thoughts, right? Oh, my melanoma is going to come back. Should be the prime that says, give you that kind of anxious feeling, right? So that could be it. Just kind of comes up from the unconscious. Or if you had some type of side effect, some type of ache or pain, or maybe you're feeling more tired, the mind can jump to, oh, this must be the melanoma, right? So the bodily sensation can go cause you that kind of fear response. Could be the anniversary of your diagnosis, or anniversary of big surgery or radiation or chemo or end of treatment. It could be any of those that, again, is the trigger that puts you into that state of mind. And it's all normal. Like, by talking about this is not going to worsen this for you, but I want you to just look at this and be with this. This is the first kind of desensitization you're going through, right? Could be a medical system. You just even see the cancer center, or going in for your appointment. Definitely, almost everybody would have that one, or a screening test, et cetera. Or if you hear about a famous person who gets a diagnosis or dies of a cancer, right? Again, it could be something that triggers you to kind of suddenly feel overwhelmed or fearful. All normal, all expected. And we're going to talk about what you do in that circumstance. Scanxiety, right? It's the anxiety leading up to a scan or an appointment to discuss the results. Typically, the pattern is, and you guys would know this better than me, is that like about a week beforehand, you start thinking about it, you start worrying about it, anxiety levels go up, you get the scan, and then, I don't know, is it a week? Is it 2 weeks afterwards? You get that result. Maybe it's hopefully a good result, and the anxiety lifts over. So you're seeing a pattern, a curve over time. Hopefully you get good results until the next scan, and then it happens again, 3 months later, 6 months later, a year later. Some people, if you can watch your pattern, maybe they're anxious for a full month beforehand and a real peak there, and then it takes them a longer period of time to settle down again. Again, normal, that would be more on the anxious side of things. The good thing about this is that you can actually train your brain, and Margot's going to talk about some of the ways that your brain can, you can rewire, rethink, re-understand how that works. So the science shows you can decrease your fears, and especially if you're in that more severe category and it's affecting your life, I highly recommend you get that medical care. So cognitive therapy, mindfulness-based work, I'm going to mention briefly, acceptance and commitment therapy. I really think that's, an excellent new therapy we talk about. And then one of the things I really like is to be able to address the fears directly, kind of live with them, see them clearly. They really reduce in power. Typically that, probably takes professional help for you to kind of work through those type of things, but I do recommend that kind of deeper psychological work. This is important. Okay, so pay attention to this one, guys. What to ask your doctor because you're feeling anxious about the whole thing. Ask directly, what's the chances of my cancer coming back, right? To know that puts that into perspective. What's the timeline? What would we expect? Again, I'm asking you to look at the deeper stuff. How would it come back? And this is key as well, right? So what symptoms would I experience to tell me that my melanoma is recurring? Is there anything I can do to reduce the risk? We're going to talk about that as well. And then ultimately, I want you to come to this state of mind to say you're doing everything possible. You are empowering yourself. And at that point, you can just say, there's nothing else to do. I can let this go. And I can just stick with what's important to me, my values in that moment. So understanding the signs of recurrence. So then therefore you stop worrying about the symptoms that aren't related to melanoma and cancer. So if you get a flu or diarrhea or some arthritic type of pains, like pains that kind of come and go, instead of worrying that it's melanoma, you just say, that's not how this would come back. So I can just let that go. I can get a flu bug or COVID like anybody else, for instance. In the melanoma example, for instance, if you had a pain that was progressive and became constant and worse and worse and worse, or a lump that was growing either on the skin, maybe in a lymph node, again, was continuing to grow. Again, that would be something that would be worrisome. Or if you're really feeling badly, right? So if you're not experiencing those things, then you can kind of relax. Okay, I have a cold. I have my arthritis is flaring up a little bit. And you can not have to be fearful about everything that happens. Okay, I want to talk about briefly this idea of working out of your frontal lobe. And I want to use the hand model of the brain. So through evolution, if you think of your wrist as the kind of the spinal cord, and then the base of the thumb as the midbrain, or the kind of most primitive brain, the fight or flight brain, and then the thumb itself, the rest of the thumb as the limbic system, which is kind of, I call the irritable kind of emotional brain, the reward seeking brain, and then the fingers over top as the important machinery, the frontal lobe. This is the best you. When you live out of your frontal lobe, you're more caring, you're more empathetic, you're more positive. Typically, you have better ability to have insight, language, connection with others. So you want to try to live in your frontal lobe as much as possible. When you get these flares of fear, you go offline. I'm scared, and you detach from your frontal lobe. They're relying on your kind of irritable brain, your stress brain to make those decisions. So it's harder to be your best self, harder to make good decisions. So as much as possible, we want to practice being in our frontal lobe so that we're our best selves and we're that kind of loving, connecting character that we really want to be. That's how we want to live our lives in some sense. The issue is that throughout the day, we're kind of flipping back and forth, feeling a bit anxious now, and then you're coming back to peace and so on. And so you want to try to practice being your best self more often. And so there's two ways to do that. One is practice and creating the conditions in which that machinery in your frontal lobe is actually working more often. And secondly, when you do lose it, when you kind of flip your lip, you can actually return home. You can kind of come back to yourself again, come back to your better self again. So it's both setting up conditions and returning more often there. So how do you create the conditions for calm? So obviously, I mean, this is the motherhood stuff right now. When you exercise, you actually release what they call myokines. It's like molecules or hormones that are stored in your muscles. And they can only be released if you actually engage your muscles. You have to actually work them out. And they go into the system. They have profound influences throughout the body, including going up to your brain. It's like instant anti-anxiety. Even 3 minutes, you're starting to get a benefit from exercising. So I'm not going to pitch this because I don't have enough time to go through the exercise part of it, but exercise is super important, especially if you run on the anxiety side. Try to exercise early in the morning. Secondly, there's something called sedentarism, which is sitting too much. In fact, I'm going to ask you, as you're watching this video, what in the seminar right now is actually to stand up just for even 10 to 15 to 20 seconds. It's supposed to be 5 minutes on the hour. You stretch. There's a whole bunch of not so good things that happen to your body if you're sitting for hours on end. So you want to make sure you're getting up and stretching, and that actually has an influence on mood as well. And so sedentarism is part of that 30 minutes a day exercise. You can influence your brain chemistry through your diet, right? So first of all, we don't want to have the sugary diet where the sugar spike and then insulin comes out and then it bottoms out and we get hangry and cranky, et cetera, et cetera. So the low glycemic diet, stay away from the sugary stuff, add some protein to your meals. There's some brain positive foods as well. Time restricted eating means not eating during the night, 10 to 14 hours at a time. We can go into the science of that later. Sleeping, there's a whole science of sleeping better, how to facilitate a better sleep. Again, you become more resilient when you take care of yourself in those ways. Again, there's the science around that. Practicing a relaxation technique, I'm going to mention later as well. You're training yourself to be more calm, right? Do the things that nourish your soul, right? Including walking in the woods, for instance. Is that what you like to do? Touch, physical touch. Even if you live by yourself, you can kind of give yourself that kind of oxytocin rush by doing that, staying connected with others. Creating the conditions for calm means staying away from the stuff that doesn't serve your soul, right? So television news is meant to be sensational and upsetting. Too much social media as well. Social media is good if you want to connect with other people. Avoiding the other, no alcohol is the right amount of alcohol. Mindfulness, paying attention to the here and now, is one way to settle down your anxiety. We can talk about that later as well. Okay, so the last thing I want to talk about really before I hand over is, what do you do when you're feeling anxious? Suddenly anxious, you get a sudden flare up. I'm scared, I'm frustrated, I'm overwhelmed, I'm fearful, right? So to recognize your physical symptoms, I'm having a stress reaction, could be any one of those things that cue you in to say, oh, I'm feeling stressed right now. Could be an emotional reaction. You're feeling irritable, angry, upset, seeing red, again, want to cry, could be the cue for you. Your thinking can change. When you flip your lid, you're working with your irritable brain, so it can't think as clearly. That could be the cue to say, I'm stressed right now. or what you think, right? If I start swearing in my mind, I know I'm having a stress reaction. So that's labeling or swearing or those type of things. Again, all those are to say, okay, I've lost it. I'm upset. I'm anxious. I'm scared at this moment. And then what can you do? Well, first of all, you want to practice. You have a plan. You use the mindfulness. First thing you do is actually watch very carefully. You can even do this right now as I'm chatting with you. What are you actually experiencing in your body? What are the sensations? What are the thoughts? So it's a metacognition. You're being able to observer consciousness is watching what's happening, which actually puts you into the frontal lobe. If you can't talk yourself down, I'll take you through a breathing technique. Pretend you're relaxed. If you slump or pretend you're chewing, it's what I call body up. The body's relaxed, your mind becomes relaxed. Remember what it's like to feel good. Oh, it's fun to hang out with my grandkids. Isn't that fun? I'm going to get to do that again, right? Or talk to somebody. It's really super important in what Melanoma Canada is offering here as well. Okay, so I want you to do this with you. So you recognize that you're anxious in this moment. I'm scared. I'm upset. Okay, so first thing, 99+% of the time, you don't have to do anything. You can just press the pause button. So you press the pause button on the video of your life and then become very curious about the physical sensations that are happening in your body. Do this with me right now. What's happening there? What do you see? With me, 4 slow breaths, especially slow on the out breath. Just do this twice now. Long, slow, smooth out breath. Curious, calm. And then that sends a signal up to your brain to say, actually, I'm okay. And then you can talk to yourself with that wise and compassionate voice and use the cognitive therapy techniques that we're talking about here. So you want to practice a relaxation technique on the day-to-day, because that will get you better at tapping into what I've just described to you. I'm not going to take you through Unwinding Anxiety. I don't have time for it, but I think this is a fantastic book. It's really looking at the science of looking at your habit loops, right? The habit loops of either distracting yourself when you're feeling anxious or ramping up the anxiety and feeling more and more anxious with time. So that's the problem, is you get into these loops that aren't helpful. So instead, become mindful, become very curious about ourselves, and you can map out your loop. And then you replace the feelings with a sense of curiosity. What can I learn from this? How can I empower myself? Okay, so Margot's off to working with your thoughts, but I'm just going to give you a quick plug for our program, cancerpep.org. 6 months, science-based. Everything that I'm talking about here, we actually integrate into the program and much more. So daily emails and videos from myself and my wife, who's a psychology professor. And so it's like yoga, strength training, diet, restricted eating, habit formation, stress reduction. In fact, we talk about fear of recurrence. There's a buddy system. And we're probably within this next month or so going to launch the next series for a cohort of people. So if you're interested, I would highly, highly, highly recommend it. Please visit cancerpep.org. On the website there, you will see a video that explains the program. You can sign yourself up. So yeah, thank you.
So much, Dr. Rutledge. That was really informative and incredibly helpful.